Very good morning. Happy Sunday to all the viewers out there. This is Apollo 24/7's Health Hour. We bring you an expert from Apollo Hospitals every Sunday morning, 11 to 12. You can ask all your questions in this live session. You must be watching this on Apollo 24/7's Facebook, Apollo Hospitals Facebook page, or on YouTube channel. But if you want your query to be answered, you have to type your query in the YouTube chat box only. And I request, if you are submitting a query or a question to Dr. M S Kanwar, who's going to join us very shortly, I request you all to send in the full query in single box so that I have the name, age, gender, and all the other inputs that the doctor can help you with. Rather than splitting the question, it will be nice if you can type in one chat box itself. So that's about it. And today we are going to give you away a few gift coupons as well. Be with us on the show. We are going to talk about a very, very interesting topic. आज का टॉपिक ये है, इज द पैंडेमिक ओवर? 2 साल हम लोग ऐसे एक दौरे से गुजरे हैं कि we are now starting to take a deep breath. But is it over yet? What about the new developments and discoveries? It's the time that we all talk about this. We are thinking that we are safe, but how safe are we, and what are the precautions that we need to take? Today, we are going to have an expert who is more than 45 years experienced in this field, a senior consultant interventional pulmonology, critical care, and sleep medicine from Apollo Hospitals, Indraprastha, New Delhi. Here we have Dr. M S Kanwar on the show. He has a great experience of 45 years. His professional memberships range from the Fellow of American College of Chest Physicians, USA, Fellow of Austrian Medical Society, Vienna, Austria, Fellow of Indian Society of Critical Care Medicine, Fellow College of Chest Physicians, India, Fellow from Indian Sleep Disorder Association, and a lot of awards and achievements, many lifetime achievement awards. He's been a DNB teacher, he's won a DNB Teacher Award for Excellence in Teaching. He has the oration at the National Conference, Indian Sleep Disorder Association as well, and lot of research papers, several research papers in the fields of pulmonology or pulmonary medicine, sleep medicine, and COVID-19 as well. And here's Dr. M S Kanwar. Good morning, doctor. Welcome to the show.
Thank you very much, Lakshmi. You forgot to mention, we're talking about COVID. I wrote the first textbook of COVID last year.
Doctor,
and Dr. Pratap Reddy was kind enough to launch that book on 6th June last year.
Absolutely, doctor. I think I should have started off with it.
We were still in the middle of the pandemic, and there were 79 other authors who joined me, and we had about 425 pages of the inputs and the latest research work that was coming through, and we were
Let me
updating
also add
ourselves.
something.
Yeah.
And this book has come at the point when we thought we didn't know anything about COVID. And there was
Yeah,
so much going
that's
on
right.
behind it.
Yeah,
There was
yeah,
so
we
much of
were
effort to understand. Yes.
we were getting updated every day. In fact, we were doing the rounds in the morning, the COVID rounds in the morning, which would take us several hours. And at night, usually in the evening around 6 p.m., I would sit with the books and the literature and whatever information we had been receiving, and would go until 3 a.m. every day. It went on for about 9 months. And
I must.
and then
It's not just appreciation, doctor. The kind of respect is in volumes that we cannot even say कि हम कितने आभारी हैं. This is something else only. I don't even have words for the entire fraternity, the team that you have led, who have put relentless efforts in the pandemic, and we don't even know what has gone into it. It's just whatever I see is just the tip of the iceberg. Appreciate
those
your
were
time on this Sunday, doctor.
those were tough days, very tough days. Yeah.
Yes,
And
doctor.
most of the writers, by the way, they fell sick with COVID. Myself too. I was on oxygen myself. So while being on oxygen, while hospitalized, I was still writing my chapters because that was the kind of passion at that time.
Please, hat tip. It's a hat tip. And there's so much that we need to learn from you and your findings. तो पहले क्वेश्चन मैं ये आपसे पूछना चाहती हूँ कि हम लोग अभी जो बाहर निकल के सांस मास्क के बिना लेते हैं और सोचते हैं कि पैंडेमिक खत्म हो गया, अभी कुछ नहीं है. Is this true? Is the pandemic over?
Well, frankly telling you, I have not been using mask myself for about 4 or 5 months now. Okay, now I have
Okay.
my own reasons, and I always kept justifying to my colleagues and friends and family. Um, Look, when Omicron hit the world, and we found out that it is not so virulent. It is very highly transmissible, but not very pathogenic. So it was not killing people. Very few people with very high comorbidities were hospitalized or taken to the ICU, but that was minuscule as compared to what we saw in the first Wuhan wave and the second Delta wave. So there
Correct.
was no comparison. So we actually got relieved. We thought, well, are we approaching a situation where the whole country might be immunized because of a very high transmissibility with the virus, yet it is not going to be a killer. If it is going to be just like a flu, then come on, let's have it. If it's a flu going to give me an immunity, then why should we be running after the injections, which are not reaching everywhere? Not the logistics as such. It would take several months for the any kind of vaccine to be covering the entire world, and the entire world would still not be covered. So if we are getting an attenuated virus vaccine, it was like a vaccine with an attenuated virus, which is just going to give you a little bit of fever, a little bit of coryza, a little bit of body aches, which would last just about 2, 3, 4 days, maximum 7 days, in an occasional case about 10 days. I'm talking about Omicron. Then why not have it? Why not
Yeah.
have it? And if we have it, that would lead to herd immunity. When we have herd immunity, this would give us an immunity not against the Omicron only, but the other variants which might be lurking somewhere. And unless the variation is so dramatically different that this immunity given by Omicron is bypassed, we would be safe. Then the pandemic would be considered to be over. For example, right now, look at the world. You were not seeing the numbers in USA coming down below 1 lakh deaths.
Correct.
The total numbers,
20.
not deaths, total number new infections. Now it's somewhere around 10,000. It had gone up to 8 lakhs a day. New
Exactly. Right.
infections, 8 lakhs a day. Just imagine.
True, doctor.
And the number of deaths in USA were some like 11 lakhs, double than the number of deaths in India, while the population of India is 5 to 6 times more than the US.
Larger than.
And they have better facilities. They are, you know, if you look at the entire India, the rural population where the healthcare is not even reaching at some places, considering all that, and we have done so much better despite a terrible Delta wave that started from India and that killed so many Indians. Despite that, I think we have done fairly well as compared to the rest of the world.
Thanks to the entire relentless teams that have been working behind the entire COVID warriors. Uh, Hats off to you all. But then, having said that, we are slightly better than other parts of the world. But can I ask you something? I have lost people after COVID. While in COVID, yes, there are a few family members that we lost to COVID. But also, I have lost one of my dearest staff, my personal costumer, who passed away with a heart attack and he just dropped and he was no more. This was also linked to post COVID death. How is it
Yeah.
possible? Then is it something that we're not able to see? What are the hidden effects of COVID?
A couple of situations which led to this particular scenario. One was the people who had severe COVID and who were on high oxygen concentration or ventilators, they developed severe lung fibrosis and they remained on high flow of oxygen. So even after discharge, they remained on oxygen. And these are the people who would not be walking around much. So they already have a hypercoagulable state. COVID causes a hypercoagulable state, means the blood flow is slower. The blood is thicker. Let's put it in simple lay terms. Blood is thicker, blood flow is slower, the coagulability is increases, so the clot formation in the body increases. Clot formation can be anywhere in the body. It could be in the myocardial muscles as well as in the vessels. It could be in the brain. It could be in the lungs, causing pulmonary emboli. So these are the places where if you get a major block, you can dies suddenly or within a matter of minutes or hours. So that is one scenario because of hypercoagulability. And if the patient is having a long drawn out battle with low oxygen due to fibrosis, secondary to severe COVID, so those people would tend to have more complications like infections, going into further respiratory failure, going on back onto the ventilator, back for hospitalization, sepsis, and shock. And that is another thing. The
All
third thing,
right. So,
the
yeah,
one more
doctor.
one more important thing, myocardial inflammation, the inflammation of the heart muscle. It is called myocarditis. So myocarditis was found to be far more common when they did cardiac MRIs post COVID. The COVID
COVID.
has become negative. COVID has become negative. There is no more
Okay.
fever, but the patient is complaining of pain in the chest, and sometimes the pain gets aggravated on walking, and sometimes the patient complains of palpitation. So this kind of
Correct.
phenomena went on in some patients, and when they were studied they found that the cardiac muscle was inflamed. Now when the cardiac muscle is inflamed, there is a risk of sudden arrhythmia. I mean sudden, the pulse can go haywire. It can go very high. It can go into irregular beats. Can even throw up a dangerous arrhythmia like a ventricular fibrillation or ventricular tachycardia or atrial fibrillation at times. And these are the reasons for sudden death in some cases when they were
Correct.
looking apparently all right.
Okay. So this is something that we all need to be on a watch for. So can you please explain me in a very basic, as I'm asking you a very layman question here, is COVID done in the sense if I'm infected with COVID, so is there something called a post-COVID effect or what is called a long COVID? What's the difference between these two?
Long COVID is an interesting term. The post-COVID complications were going on and on. Actually, the term didn't get coined earlier on in 2005. But when there was a COVID-1 infection, COV-1 infection, and MERS infection, again by coronavirus, in some 15 years ago by COV-1, and then again by MERS, which was deadly. 10% people died. Oh, 33% people died. In COV-1,
Okay.
10% people died. In COV-2, this time around, the overall figure of death is less than 2%. It's anything from 1 to 2%. So we were much better off. Now, this long COVID thing actually started to be discussed even in the COV-1, that
Okay.
people had, people even after infection today continue to have some symptoms a year later, a year and a half later. The same phenomena we saw in the Wuhan wave. I mean, patients would get better, would and had have no more fever, the cough, the dyspnea, and chest pains and other headaches, rhinitis, sore throats, all would go away. Diarrheas, all those things would go away. But they would say, "I'm not feeling normal. I'm feeling so weak, tired, fatigued, headaches, fogginess, brain fogginess." And this was a very common phenomena, and it continued. And now some people would feel so weak, they say, "I can't join my office, I can't walk." So that this is something which was then the term long COVID started to be coined, and in the book that I've written the chapter as long COVID. Now, in long COVID, there are many reasons for that. There are a lot of autoimmune processes going on. The COVID stimulates autoimmune process in the body, which leads to myalgia, means inflammation of the muscles, joint inflammations, and they won't let you walk without pain, aches,
Okay.
tiredness, fatigue. These were the most common of all the symptoms in long COVID. And
Right.
most of the time, they would tend to go away after about 1 to 2 months, in some cases 3 months, in some cases six months. I know cases who had symptoms even after a year. So it
Oh.
can prolong even beyond a year, but most of the time they tend to settle in 3 months' time, occasionally 6 months, and rarely even beyond that, a year.
All right. So quickly, Doctor, I'll translate this in Telugu for the audience who are watching it from APN, Telangana, because I'm from Hyderabad. So quickly for the audience who are watching it on my Facebook page, డాక్టర్ కవర్ గారు ఏం చెప్పారంటే కోవిడ్ అనేది లాంగ్ కోవిడ్ అయితే కనుక నొప్పులు ఉండడము, మజిల్స్ లేకపోతే మనకి నడవలేకపోవడము, గుండె దడగా అనిపించడము, లేదా కాళ్ళు లాగుతున్నట్టుగా ఆయాసంగా నీరసంగా అనిపించడం సహజమైన విషయమే. నెల రోజులు కొంతమందికి ఉండొచ్చు, 3 నెలలు ఉండొచ్చు, ఇంకా లాంగ్ కోవిడ్ అయితే కనుక 6 నెలలు, సంవత్సరం వరకు కూడా ఉండేటువంటి అవకాశం ఉంది. అయితే ఎవరు జాగ్రత్తలు తీసుకోవాలో ఒకసారి అడుగుతాను. థ్యాంక్ యూ డాక్టర్ ఫర్ బేరింగ్ మీ ఇన్ తెలుగు.
In fact,
క్విక్
in
Yeah.
long COVID, in fact, it's not the only thing. The chronic cough, the cough can go on and on. There could be, as I said earlier, cardiac chest pain, unexplained chest pains, which could be due to the inflammation of the muscle of the heart or the outer layer of the heart, which is called pericardium, pericarditis. So these things, and then erectile dysfunction has been so
Yeah.
common in these patients, and the reasons are decreased blood flow because of inflammation, because of hypercoagulable state, which I described earlier, and it is also due to psychological reasons. The people were depressed, they were anxious. There could be menstrual abnormalities. A lot of people lost their hair. The hair became thinner, and it took
Yes,
them
doctor. I,
almost a
I
year to get them back.
Yes,
So
so
that
I'm trying to put myself into the categories that you've been saying. I have ticked at least 4 of the categories. I have experienced all of these, and I suppose the audience would agree that one or the other symptom that we all have been through.
yeah,
So, one
yeah.
quick question before I take audience's question. What do you think COVID is going to be in 5 years from now?
Well, it is just going to be a flu-like thing, sometimes sporadic in some areas, and would go just like H1N1, the swine flu. The swine flu came in, as a serious lung infection, and the
Yeah.
mortality rate was also fairly high. But when it came under control, then it was only in some pockets. Sometimes, when the patient presents like that, we do those tests. So same thing will happen in COVID also. Whenever we'll get a patient who would fit into those symptoms, we'll routinely do a COVID test, and an occasional COVID test may turn out to be positive. So it will be in some pockets here and there, like a flu, and I don't think it is going to be like a Del Micron. The worry was Del Micron. Let me just explain. You have a minute?
What is that?
Uh,
Yeah.
the worry among the researchers a few months ago was that Delta was getting mated with Omicron. Now Delta was so
Oh,
severe. So you know the pathogenicity of Delta. Everybody was scared of Delta last year. But Omicron is so transmissible, many times more than Delta. So if they had been mated, so that a very virulent organism would have come up, which would have also had the capability of transmitting so fast that it would have caused havoc around the world. So Del Micron, the researchers were worried about that. So that
so
didn't happen.
is that looming still on our heads? Is that a
No,
possibility?
no, no,
Ah,
no, no,
thank
no,
you.
because
Thank
Omicron is
you.
taken care. Omicron is taken care. So that is, Omicron has already spread its immunity. So Omicron is not the one which is going to come back and do something. Whenever a new wave comes, it has to be a new variant. It cannot be an
Right.
older variant
Old
coming up with
variant.
something. Yeah, no.
Great, doctor. Thank you so much. That gives me some hope and power with the positivity. I would want to take audience's questions from now on. Munna Kumar ka question hai, doctor. Thank you so much for this session. I have witnessed COVID pandemic. Family, near and dear ones we've lost. Now I want to understand what could be the symptoms and how to mitigate these after COVID. So, what does one need to watch out for? Thanks, Munna, for asking this question. Because what are the symptoms that I need to look out even after I'm out of COVID?
Oh, once you're done with COVID, you have become negative. So if you're having a body ache, a headache, a brain fogginess, or unexplained chest pain, unexplained cough, ongoing diarrhea, your gut is not behaving normal anymore, something, a feeling of something in the nose. It may be nothing, or there may be a little crust formation, but a feeling of foreign body which can sometimes go on for a few months. Sometimes your appetite may not return to normal. Your sleep may become an issue. You may have brain fogginess and anxiety and depression. And if you have other symptoms like your hair are falling, and you're worried about that, why am I'm not more suffering from Omicron anymore, so why my hair are still falling? So these are the things. Erectile dysfunction, menstrual irregularities. So all these things can go on and on, but if you have any of these, you should see your doctor, and he'll help you sort out things.
Can I add a question to Munna's doubt here, Doctor? Dr. Kanwar, I wanted to check if there are any tests that I need to monitor myself, because frequently the brain fog is real, the anxiety is real, the hair fall is real, and then I also feel palpitations at times. My thyroid, my other hormonal functions are not really very well. So, do you think that I need to get some tests done even
You
after a
see,
year of?
let me tell you, when somebody presents with these symptoms and with the background of having suffered from COVID, then as a routine, certain tests are done. For example, somebody would like to check your vitamin D levels, vitamin B12 levels, your routine blood counts, because we don't want to miss something underlying. We might even do your autoimmune tests to see whether you have a propensity to develop these things much more than a normal population. So all these things are routinely done, but let me tell you, majority of them would turn out to be negative. Majority of them, except vitamin D level, which in Indians and Asians is inherently low.
Exactly.
So you could give vitamins and other things. But in general, if you have these kind of symptoms, I mean, you have to go specific according to the symptomatology. But for general poor well-being, you know, uh, general weakness, tiredness, body aches, arthralgia, we advise graduated exercise. Graduated exercise. We don't push them. We have cases where somebody wanted to be heroic. Oh, let me just go to the market and carry the load and come back. And for 2 days, she couldn't leave the bed. So, graduated exercises, breathing
Correct.
exercise, graduated, and good healthy diet, good sleep.
Thank you. Yes, doctor. So I'll quickly wrap that up. ఒకవేళ కనుక కోవిడ్ తర్వాత ఇందాక మనం చెప్పుకున్నటువంటి సిమ్టమ్స్లో ఒళ్ళు నొప్పులు, లేకపోతే నరాల నొప్పులు, ఆలోచించలేకపోవడము, యాంగ్జైటీ, డిప్రెషన్ ఆర్ జుట్టు రాలడము, బ్రీదింగ్ ఇష్యూస్ ఇలాంటివి కనిపిస్తున్నట్టయితే డెఫినెట్లీ కొన్ని పరీక్షలు చేయించుకోండి. మళ్ళీ మీ డాక్టర్ని కలవండి. డాక్టర్ సలహాతో ఏం చేయాలో ఒకసారి మానిటర్ చేయించుకోండి. రెండోది, గ్రాడ్యువలీ మంచి లైఫ్ స్టైల్లోకి రావడం, ఎక్సర్సైజ్ చేయడం అండ్ బ్రీదింగ్ ఎక్సర్సైజెస్ చేయడం ఇంపార్టెంట్ అని డాక్టర్ కవర్ చెప్పారు. Well, next question that I would want to take from the audience is Mr. Ankur Dalmia. Ankur Dalmia. My child Sivanch is 2.5-year-old, 2.5-year-old, suffering with high-grade fever only. COVID IgG negative, just the typhoid positive. 103, 102. Is there a possibility of he having COVID?
Right now, no. Right now, first of
Okay.
all, the COVID is almost gone, almost gone. Very little COVID positivity among the tests done. And typhoid is already found to be positive. So
Okay.
there could be, it could still be just a viral infection in a 2.5-year-old. Viral infections currently are, which part of India is he from? It all depends on.
Ankur has not put up his
Okay.
area
Okay.
agent.
If it is from North and Central India, this is the time when the viral infections are very, very high. And so it could be a viral, but if the typhus test is positive, it could even be a typhoid, if typhoid is positive. So, but COVID, no, I wouldn't suspect that in this case.
Yes, doctor. Thank you. So, in addition to Munna Kumar's question, he's posted it after your answer, doctor. I had high levels of D-dimer post-COVID. I took a few blood thinner injections and the level got slightly better. It's been more than a year. Do I need to be concerned about D-dimer now in the body?
No, no. Usually, the D dimers, the hypercoagulable state, which I talked earlier, it lasts about a month to 3 months post COVID. And depending on the D dimer, we have been giving Eliquis. Eliquis is apixaban to as a blood thinner. Depending on the level of D dimer and the risk involved in a particular patient, like comorbidities, obese, and other things, and other keeping all that in mind, we give either 5 milligram twice daily or 2.5 milligram twice daily. But we keep an eye on the D dimer. If the D dimer comes down below 500, that is the time to stop the Eliquis or the anticoagulant. So
Yeah.
it could be stopped in a few weeks' time. Sometimes it could be extended to 2 to 3 months. Usually not beyond that.
Uh, Thank you so much for answering Muna's question. Next is Mr. Sean David's question, and I think I will also add my personal experience here. Sean David is 65-year-old male. He's under treatment for COPD, diabetes, and blood pressure. Endocrinologist advised me to take vaccines for flu, pneumonia, and hepatitis B with a specific gap. He's already done with the flu shot. When should he take the pneumonia shot? This is one.
Just keep a
And
week.
my
Just keep a week between the two.
Okay, so Sean David G, just between these week between these two, and do consult with the new flu shots and the pneumonia shots. My question here is somebody like my father's age, who's 80 plus, who's done really very well with COVID at home with COPD. Twice that he went through, both the variants that he went through. So does he? Does it help giving him the flu shot every year, like how he took
Yes.
earlier?
Yes, yes. The flu shots, they also these days cover H1N1. Some coverage for H1N1 also.
Okay.
So it's better. Somebody who's got COPD, who's got hypertension, who's in 80s, yeah, it should be
Great.
a routine preventive measure.
And the pneumonia shot, once
Chemo
they get it,
once in 5 years, pneumonia once in 5 years,
once it.
and flu shot once a year. And the best
Great.
time to have the flu shot is end of September, beginning October, when the new lot comes. New lot
Correct.
comes in around September.
Yes. Thank you, doctor. Next question is Tanuja Ghosh. She was infected with COVID and recovered really very well. No major impact, but I have cough. It feels like stuck in my throat for many weeks. Can you recommend any specific solution? I tried various syrups for a long time.
All right, this is a feeling in COVID cases of, I'm trying to do that.
Clearing up.
You're just trying to clear something which is not there. It is
True,
because of a
doctor.
little inflammation there. There is no secretion sticking there. So it's just a
Oh.
feeling like that. Steam inhalation, hot saline gargles, and anti-allergic. That's all you need. Anti-allergic
So I
like
would. Could you
Cetrin
just
10
repeat all of
milligrams
them,
at
doctor,
night.
once again? Could you please repeat
Steam,
them once?
steam inhalation 3 times a day, hot saline gargles 3 times a day, and anti-allergic like Cetrin or fexofenadine, 1 tablet at night.
Okay, so I'll repeat that in Telugu for the audience who are watching it. ఒకవేళ కనుక కోవిడ్ తర్వాత కూడా చాలా రోజుల వరకు మీకు గొంతు ఇబ్బందిగా అనిపించి దగ్గు వచ్చినా తెమడ బయటికి రానట్టు అనిపిస్తే దయచేసి వాటికి మీరు గార్గల్ చేయండి ఉప్పు నీటితోటి స్టీమ్ చేస్తూనే ఉండండి అలాగే ఏదైనా ఒక మైల్డ్గా యాంటీ ఎలర్జిక్ టాబ్లెట్ ఏమైనా వేసుకోండి అని చెప్పారు. Next question is that it, doctor? That's it. No other cough syrups, as she
No,
was saying that she
if
needs a
she
lot of syrups.
unless she's coughing quite a bit, then anti-allergic cough syrup can be added, and cough suppressant
Great.
can be added. But usually these three things, what
Okay,
works.
great. I think Sandhya, you'll be feeling better if you start doing these things. Great. Next is Alicia's question. Alicia is now a 25-year-old. She had COVID, and after that, I've been experiencing memory loss and extreme forgetfulness. Sometimes I forget common things and also a memory gap of a day or two. What do I do? This is real, doctor. Even I face this.
Something like a mental fog, which happens, all of a sudden, and within a few minutes, you feel better, you feel normal. Well, this has been a problem with COVID cases in many of them, and also it is not necessary that COVID has to be severe to be able to cause this kind of memory loss. The COVID can be milder or moderate degree
Okay.
also to be able to cause this. It seems to be an autoimmune reaction, and it will come back. And in case she feels that memory is really bothering her, then there are tablets which is like, for example, Arisip 5 milligram. She can take it for 1 month. Arisip 5 milligram after food.
Okay.
Arisip.
Well,
Arisip
I think.
5 milligram. ARICIP.
All right.
5
I hope
milligram.
you,
Yeah.
Alicia.
Let her
Yeah.
take for about a
Not many.
month.
Yeah, not many doctors do prescribe it over the show, so this is something new for them. I think Alicia would get the tablet too. So, doctor, one quick question here. Do I need to get any tests done? That is this? Is there any way to understand that this is a COVID related or post-COVID related symptom, or generally my health is not well, or how do I
Well,
differentiate?
if in the history, the whole thing started post COVID, and there were no such symptoms before that, then we can relate all these symptoms to COVID. And
Okay,
we also know that all of them would gradually disappear. It will take a
okay.
few weeks or at the most a few months, but they will all settle down. And
Hmm.
the type of things which we talked about, some vitamin, some physiotherapy, some rehab and graduated exercises, good nourishing diet, good sleep, and in case the myalgia or muscle aches or arthralgia is quite severe, then only we give some tablets for a couple of
Yes.
weeks.
Okay.
Otherwise, settle down.
Done. So here's Dinesh's question. Dinesh is 31-year-old male, and he is asking a question which is a practical, real question. Feeling pressure in my chest and low confidence in my sexual health after recovering from COVID. As you were also mentioning that erectile dysfunction has cropped up. How does it really affect, and how did this come up?
This pressure in the chest is all psychological in these cases, unless
Okay.
we prove that there is a myocardial involvement. The myocardial involvement happened, or he had a history of palpitations post COVID, or chest pain, not heaviness, chest pain post COVID. Then only we'll start thinking about myocarditis, post COVID myocarditis, or pericarditis. But otherwise, this pressure and these are psychogenic changes, and in his case, most likely it is secondary to uh, sexual dysfunction at the moment, which would improve, which would improve over time as the inflammation settles. And there are certain drugs which are given for a few weeks, which help them a lot. So
All right.
since you suggested, I shouldn't be suggesting the product.
Yes, doctor. Thank you.
It's fine. Yeah,
All right.
it's fine. He should just see
Yes.
his doctor, and he'll be taken care of. No problem.
Great. Thank you so much. Johnson is asking next question. Namaste, Namaste, Dr. G. What is the proper SOP for a daily routine of people prevention in a populated public space or office? Is mask still mandatory? Proper hand and health hygiene, especially for children.
Well, children wouldn't usually follow those things because they're in the school. In the school, they live in crowded surrounding anyway. So either it becomes mandatory by the school authorities to ask them to use the mask all the time, because in a class of 30 there'll be at least 3 4 5 3 4 5 6 7 kids who will be coughing or who will be having cold. So there's no way, unless you do the testing, to know whether it is just a simple cold flu, or is it it's something to do with COVID. Yeah, if the patient is having fever, again it could be due to flu, as it is happening now, or it could be due to COVID also. But COVID is something, when in general population, the COVID has ebbed, it's gone down, and the testing now is not showing enough cases. For example, in Delhi itself, I think the number is just under 100 in a day, less than 100 for a population of one and a
Yes.
half crores. So I mean, this is minuscule. So one should not be paranoid about that. But yes, I mean, you should now be taking similar precautions as you take for COVID as you take for flu. If somebody is
Correct.
coughing in your presence, in your room, at your home, if somebody is coughing and is having coryza, so you would ask them to, you know, cover
Cover
the
up.
mouth. That precaution should be taken. That precaution should
Yes.
be taken. And regarding crowded places, when the overall incidence or prevalence of the disease is low, then it really doesn't matter. Now, in the flights, for example, you're sitting in the flight for several hours with another 200, 300 people. So, how many of them are actually using masks? And do you think some of them are not coughing? Some of them are coughing too. So that doesn't mean that every person who is coughing is having COVID. That was the stance we took in the first wave. That was the stance we took in the second wave. Anybody who's coughing, COVID, unless proved otherwise. That is no more the case.
So, can I ask you one question here, doctor? Now, the onus or the responsibility of wearing a mask and protecting others comes to the person who's having some kind of symptoms or chest congestion.
Absolutely. You got the point. Absolutely. That
So,
is true.
it's if I am not well, I should be responsible, not
Yeah.
spreading it.
Yeah.
Correct.
Or he could be nudged to cover the
To cover it.
the face.
Yes.
Yeah.
So the large lesson that we've learned from the pandemic of wearing mask and being in a mask for long hours is
Yeah.
now to the population who are struggling or having some kind of symptoms. So
Yeah.
that's it. Thank you.
Yeah. In US,
Next.
in UK, by the way, for the last year or so, there's no use of masks at all. When I visit there, nobody is using masks. Even it was mandatory in the shopping centers earlier on. No, it was taken off some 6 8 months ago.
So it's now my personal obligation that I should be having some
Yes,
kind of responsibility, and it's a personal
yeah,
responsibility that we all should be taking care. All right.
absolutely.
Next
You're right.
question. Yes. Next question is from Sai Jyoti, who's 39-year-old female, had COVID infection in 2021, and my post-COVID symptoms I had frequent dizziness to 4 5 months. I still get this once in 15 days. Is this due to COVID?
Yeah, most likely. At 39 years, we don't expect people to be having dizziness. If the blood pressure is all right, and if there is no other disease, autoimmune disease, then the possibility is that it's still lingering on post-COVID effect in her case. But it will settle down. Does she have vertigo? If she doesn't have vertigo, if it is just a dizziness, if sometimes people feel that the earth is moving and they could even fall, then we give them tablets for a couple of weeks, and that
Okay.
settles. Yeah.
Great. So here's another question regarding the vaccines and the COVID as well. I got COVID twice even after taking vaccine. And post-COVID, developed trigeminal neuralgia and it's terrible. Also had GI issues. Been taking medicines for TN, but I got COVID again. My TN pain is severe. What's the TN?
TM,
Trigeminal neuralgia.
trigeminal neuralgia is
Yes.
severe pain in the trigeminal distribution of the pain of the nerve. The
Okay.
trigeminal nerve is supplies this part of our body,
Okay.
and the
Okay.
pain can be severe. So, well, if it happened due to COVID, they tend to improve quite a bit with steroids. We tried steroids in these cases because the whole thing is due to inflammation, autoimmune inflammation in the areas, and there are narrow places where this nerve goes through in our skull, and if there is inflammation, it gets compressed. When it gets compressed, it will lead to pain in its distribution wherever it is. So it has three branches, and all three get involved, and it leads to pain there. So steroids work very well in these cases. I'm sure the doctor might have considered that. So just for a short period, for a few weeks, and the pain and the inflammation settles. It is an autoimmune reaction in these cases.
Okay, great. And you've been saying this word autoimmune disorders after COVID for I've been observing that is that something that we all need to watch out for, and how do you keep a track of it?
Well, if the new symptoms develop, and for no reason you have pains, aches, joint pains, then you start suspecting that there might be autoimmunity developing, and you do certain tests for that. And COVID is known to cause that in some cases, but then it's self-limiting, and in a few weeks or a month or two, they tend to settle down, and so they can be treated.
Okay. Here's a registered user's question. How long does immunity last after COVID? I think this question is like post-COVID, the COVID immunity. And also, I would want to take up few myths about COVID vaccine. So there's so much of confusion around vaccine. See, I got COVID after I got the vaccine, or I have symptoms of certain symptoms after vaccine. Is this true, doctor?
Well, let's talk about them individually. So, first of all, you said the immunity, how long does it
COVID and
last?
immunity.
Yeah, the immunity lasts better in children. In children, the immunity would last about 14 to 16 months, and in adults, the IgG levels would start to come down to barely noticeable levels in about 8 months' time. So in adults, it would last about half the time as it would in children. So that's why the vaccine companies were very keen that the immunity should last at least a year, so that it becomes a yearly infection, a vaccine process like they do in flu vaccine cases. So they were hoping. They have reached somewhere. There have been a lot of modification in vaccines anyway. So the vaccine improvements have been going on. In fact, we have been dealing with monovalent vaccines so far. So
What is
we
it?
need monovalent is the vaccines targeting at one area. Most of the
Okay,
vaccines are targeting at one area, like the spike protein. So if
okay,
there is a vaccine which can target the spike protein, all the spike proteins, and also the surface, the cell surface, and inside also, then it would be called polyvalent, and it would be much more effective. So,
okay,
and the other thing is, it should not just be acting on the antigen; it should also be acting on the T cell receptor. So, if you have an action both on the antigen as well as the T cell, then the immunity would be much longer, much more broader coverage, and much longer. That would be the answer for a prevention of COVID in future.
in future. So, how about the myth that has been going around, or there's so much of rumors that go out कि किसी ने वैक्सीन लिया और उसके वजह से उनको कुछ हो गया है और कई डेथ भी हो गए हैं. Are they proven, doctors?
2 points to be considered. When the vaccine was given, when the disease is all around, everywhere, so it is also possible that the person was already having the dose of the virus also in the body, and the the two things happen almost simultaneously.
Okay.
And so, if the COVID was found to be negative in that patient, then you would say that it is only purely due to vaccine, not due to the COVID disease itself, which might have affected the patient simultaneously in a high prevalence zone, like we were in, all of us. There was a risk of developing it any time, any day. So, this is one thing. The other thing is, yes, it has been proved, and in post analysis after launch of the vaccines, and in subsequent analysis, there was a report, I think in March, where it was shown that September also, it was shown that the the risk of developing certain complications was real, and myocarditis was real. In some neurological complications were real, and so then they started to compare whether the giving the vaccine was harmful, uh, or if they had not received the vaccine, would they have been better off? So it's probably still goes in favor of giving the vaccine, because it is presumed that the severity of the disease is comes down, even though it does not prevent the people from having the disease in most situations, but the severity of the disease is curtailed. So that is an important aspect. If you're having a disease, staying at home, not having to go to the hospital or getting an oxygen or ICU, then you are getting the immunity, and you get over with the disease in a better way. So on the whole,
So wait.
the evidence is still in favor of using the vaccine, even though the vaccine has had its own share of complications.
So the benefits way higher, and we have to give it
Yeah.
for the benefits. Yeah. So here are two more questions related to vaccine. Johnson's, in continuation, is thanking you for the information, and also he wanted to add: is the vaccine prevention now mandatory or optional? Now that you have said every year the companies are thinking of making a vaccine every year like flu shot, is it still in the pipeline? That's one. And Ramya Nagaraj is asking, is the fourth dose in some countries, there is fourth dose in some countries which is being promoted, or is second dose good enough in India?
Again, now that the lobby against vaccines is growing, so there may not be too enthusiastic government responses in favor of pushing in vaccines like they were all over the world, including
Correct.
India. You know that. And for travel purposes, you wouldn't be able to travel without showing them the vaccine
Well,
certificates. So that still is applicable in many parts,
correct.
but gradually being weaned off. Uh, so they thought that if there is a vaccine, the chances of disease would be less, and even if he develops the disease, the severity of the disease would be less, so that the burden on their health services would be low. So that would be a safer option for the travelers. So we have all suffered through that. Going to England where my children are, had to have. I've had my COVID test done for 17 times. 17 times, my own COVID test, because you have to do it before. Then when returning from England, you have to do it. On arrival at Delhi, you have to do it, and then sometimes 5 days later again you have to do it. Those were the days during Delta times. Anyway,
Doctor.
the point is that the enthusiasm about vaccine being compulsorily being pushed is gradually going down because of the opposition that they have to
The lobby
face,
which is
especially in view of some of the vaccines not showing the results they were claiming to have. They were claiming 85% efficacy, 90%, 95% efficacy. You remember that? which
yes,
later
yes, yes.
on which later on was questioned, how did you calculate this? And then when it came down to something that, well, was it really effective or not? So there were, and let's not talk about controversial things here, because there have been a lot of pressure and push by the vaccine companies on various governments to allow emergency use authorizations. Emergency use authorizations for vaccines had never ever in the history of medicine been done until this COVID,
COVID.
because the whole thing was just falling apart so fast, and everybody was so doubtful about what will help, what will not help, that they were forced to give emergency use authorizations, which normally they give only to certain emergency drugs. And
Yeah.
so anyway,
Good.
I personally feel that they will not be pushing for vaccines too much like they have been doing before, because some sanity has already come into the circles and the authorities and the WHO also.
Yeah. So thank you so much for throwing light there and then being very. That's an interesting point of view which you hold, and which is actually, a question of there's every chance of debating on this, and we would not
Yeah,
want to go there. For the
yeah,
information's sake, yes, you have placed the right information for the audience to take a call. Next
yeah.
question I would want to take is a registered user's question. Doctors in my region are not recognizing post-COVID syndrome. What can I do?
Which region is that?
That's a registered user's question. Can you please, if the person's, if the person is watching this in the live show, if you
Post-COVID
can type.
is Post-COVID is an established syndrome, and it is proven everywhere. In fact, the first countries to recognize post-COVID syndrome was Italy, Spain, and USA. Italy, Spain, and
Yeah.
USA were the first ones, and UK. And they set up post-COVID clinics. Post-COVID clinics were especially for long COVID cases,
Okay.
special post-COVID, long COVID clinics, and they were having tie-ups with the rehab programs, and they were like, how to, uh,
Let
give
me
them
also point out that Apollo 24/7 also has a post-COVID care, entire segment dedicated to your post-COVID symptoms. In case you're not finding it on your region, please come online. There are
Yeah.
experts with such great capability online 24/7, so you can use them
In fact, every
easily.
aspect of post-COVID syndrome, every aspect, the head to toe, there are so many symptoms. Every aspect can be taken care in some way or the other. So it's
Yes.
just that they have to recognize that this is post-COVID syndrome.
Correct. Here are two questions which are again registered. One is a registered user's question. What health changes will be permanent after COVID? And the next question is from Mr. Ravi Kumar, who is 67-year-old male. What is the most important parameter to be monitored for a heart patient after COVID? The two different questions, but
Very interesting. Very interesting. Firstly, I don't think there'll be anything permanent except lung fibrosis. Lung
ah,
fibrosis in severe COVID disease, but the lung fibrosis in COVID improves over time, unlike interstitial lung disease or interstitial pulmonary fibrosis, where the disease is progressive. It goes on increasing, goes on worsening. In COVID, when the lung fibrosis, you survive the fibrosis, you survive the ICU care, the ventilator care, and then you see 3 months down the line, 6 months down the line, the lungs are looking better. The CTs are looking better. The lung function is better. 6 minute walk test is better. So everything improves. So, but even after a year or two, some fibrotic changes would remain. It may still kind of lead to some 10 to 20% restriction on your pulmonary lung function test. This is the only thing which can be
only
permanent, but that thing also keeps improving with time. The other things are not considered to be permanent. And the second question was
the heart patient post
heart patient.
COVID. What is the most important parameter to be monitored?
For any heart patient, if he develops COVID, the things to check is you remember two things. It would lead to inflammation and it would lead to hypercoagulable state. Hypercoagulable state would lead to increased risk of coagulation and a coronary artery disease or a pulmonary embolism. So this is one thing. The other thing is inflammation. Inflammation in the coronary vessels would lead to narrowing of the coronary vessels, which would lead to less blood supply, which would make the heart more prone to developing angina, chest pain, and even arrhythmia, sudden, fluttering or irregular heartbeat. So these are the more common things. Yes. So by narrowing of the blood vessels and by increasing the coagulability, you are increasing the risk of heart attack in these patients. So you have
Right.
to be
So
cautious about any new symptoms developing.
correct. And any tests that you would recommend, and what's the frequency of the tests?
Usually, if the patient is asymptomatic, we don't do any special tests for that. But if the patient
Okay.
is having some new symptoms of chest compression, so the heaviness in the chest, or a palpitation, or a vague pain in the chest, or chest pain on walking, then we do their echo, their TMT, their tropi, their ECG. Then we do all these tests to see whether
Okay.
there is an inflammation related ischemia.
Yes, doctor. Next question that I would want to take up is Yasira Khan. Doctor, the daughter is 18-year-old, and many times that she had symptoms of COVID, but she's not tested positive when checked. Now she's not yet vaccinated. Does it help if she gets vaccinated?
Well, let her do IgG level.
Mm-hmm.
IgG for COVID. If the
Okay.
IgG for COVID is normal, that means she truly didn't have an infection. But if the IgG is already high, that means she probably had
Has
infection one of those times, but it was not picked because we can actually not do the test properly, not take the sample properly, and up to 30% can be false negative.
that's also
COVID test
there.
can be false negative up to 30% of the time. So it all depends on how well you take the sample from the nose and throat. So if she does an IgG, if it is normal, she should do the vaccine. If she IgG is good, there's no need for vaccine.
Okay, great. So here's next question. Kapil is asking, hello doctor, wanted to understand the rationale of prescribing antibiotics in a viral infection if it was not effective in COVID being a virus.
Well, antibiotics don't really have any role But the only time you give antibiotics alongside is when you suspect some cross infection or a concomitant infection with the local commensal, a simple streptococcus and other bacteria which can settle down, Marcella, and those things which can flare up. But normally, for a viral infection, for a flu, I mean, you don't give antibiotics. You give it or you don't give, the recovery is going to be the same.
Yeah, yeah. So, talking about tablets and antibiotics, we've done so much of supplementing, doctor. इतने सारे vitamin C, D और zinc इतना सारा ले लिया है हमने. Did that really help?
No,
Okay.
it was all for our satisfaction. It really it wouldn't have worked in any way. But
Yeah.
yeah, it was a practice to give zinc just because some reports showed that. But there were
Yeah.
hundreds and hundreds of such reports which were showing positivity for something or the other, and they were withdrawn later on. Even some drugs who were like tocilizumab, and which were like touted as the treatment in severe, very severe cases. Later on, people started saying even there were question mark on remdesivir. So, zinc and other vitamins really don't really have anything.
Yeah. Now, quickly before I wrap up, I'm done with the questions from the audience as well. Initially, we had certain parameters to understand how the severity or the precautions for COVID. Are they remaining the same? The vitals, the oxygen saturation, in case somebody is getting COVID, what are the things that I need to check right now? And how many days of isolation or quarantine?
If you're suspecting COVID, you should look at the symptoms first of all. If there is fever, unexplained fever, sore throat, runny nose, or nasal blockage, these were the three most common symptoms. Some people would have diarrhea, some people would have headaches, body aches would be common in many cases. So, chest pain, wigs, chest pain, uneasiness, all these things could be, and in some cases, joint pains also. So these are the usual symptoms of COVID. If you have a set of these symptoms coming in, but then these symptoms happen in flu also. These symptoms happen in dengue also,
Dengue?
and many of these symptoms would happen in typhoid also. So, so you have to check what you're dealing with, and if you find yourself to be COVID positive, then the chance that you will be you would have recovered from Omicron variant. We are dealing with Omicron B5. So in worldwide, so it started with Omicron, that it had some variants of BA1, BA2, BA3, BA4, and BA5. So every newer variant was more transmissible and had greater chance of evasion of the vaccine as well as the previous infection. But the good thing was that the pathogenicity was low. So it was distributing the COVID, causing a little symptom, yet actually immunizing people. So it was like a attenuated virus being distributed by the virus itself to the public.
Yeah.
That's how
Right.
we are where we are now,
All
mostly
right.
having herd immunity at the moment. So the
So, how many days of, in case is positive
the
right
one
now, how many days?
just to finish that,
Yeah.
the positivity would last about 6 to 10 days. So if you
Okay.
repeat the test after 5 days, you may still be positive in about 80% cases. But by seventh to 10th day, most of them are negative, unless you are immune compromised, where it can be two weeks also.
Yes, doctor. Thank you
Your
so
question,
much.
your question
Yeah,
was
no,
just
how many days of isolation before they get back to work and they're not spreading COVID to anybody
in
else?
Omicron, the isolation thing gradually evaporated. In fact, it was just about 5 days by official circulars. But
Yeah,
earlier on, in wave one and wave two, we had 14
it
days
was
of isolation.
14 days. Yes, yes.
And then after 14 days, again repeat the test. And then if it is positive, another 5 days isolation. So those kind of things. But it's not the case anymore. So probably 5 days of isolation is more than enough, but it was also not mandated. And the government
Okay.
offices as well as the private offices also were not happy that the employee was on leave because of COVID.
Okay. But yeah, it's important to take care of others as well, not to give anybody else. Take precautions is important. So now that we are done with our questions, I would quickly want you to give me top tips of understanding post-COVID and long COVID and what are the symptoms that one needs to take care of.
Well, COVID is almost gone, but it's not gone yet and completely. And also, it will not. Don't think that it will not come back. It can come back, and I hope it doesn't come back with a vengeance. It doesn't come back with a highly pathogenic organ or highly virulent organism, and which is very highly transmissible also, because that would be a win-win situation for the virus, but a very bad situation for us. Let's hope that never happens. But probably pockets of this infection, just like what happens in flu in different regions, would still be there, and you could see that phenomena happening over the next few years, and even later. I mean, coronavirus could always come back in one form or the other, and maybe 10, 15 years down the line, a new coronavirus with a little different shape. They may call it COV3, um, might show up. But then by that time we would be having probably a whole lot of vaccines. We are already prepared for with them, and probably a newer, more effective vaccines would be available, and which may be giving a cover against all kinds of coronaviruses, beta coronaviruses, all kinds of beta coronaviruses, not just COV1 or COV2, even MERS. So that is a scenario which we are hoping to see very soon, maybe in a year's time. And so we'll be better prepared. Believe me, we'll be better prepared. We were taken off guard, but we'll be better prepared in future. So if you think you have COVID disease, you should immediately consult your doctor. Don't try to treat yourself as flu or whatever, because you would be spreading it to others, not even knowing whether you're carrying the disease or you're spreading the disease to others not. So it's better to have yourself checked. Don't be afraid of that. And once you have it, then be careful using mask, using hand hygiene, avoiding going anywhere, mixing up with in crowds, even mixing up with family members. So just be careful about that, and take plenty of liquids, hydration, good nutrition, and just basic treatment for fever and body aches and stuff, and maybe some vitamin. And then a few days later, when you're feeling better, you want to join your office, please do that. And but it would be better to use the mask for the next 5 to 7 days, just for extra precaution. And if you're traveling and going into crowded places, like you're going for some big events or things like that, or flying in an aircraft where you'll be sitting with other people for several hours, it's better to keep a mask on. It's better because that has become a sort of a norm now, and it is not a bad norm. So you don't know, the person next to you might be coughing. Even if he is having flu, he could at least give you flu, and flu itself can give you fever and cough and body aches for the next 3 4 days. It could mess up your trip wherever you're going. So it is
Yeah.
better to take those precautions, and don't be afraid. This COVID is not going to kill you anymore. It's rare unless you are severely immunocompromised. You're on chemotherapy. You're on treatment for some transplants, or you're too emaciated. So you will do very well. Don't worry.
Fantastic, Dr. Kanwar. Thank you so much for being on the show on the Sunday morning. We understand your time is very precious, but you have shared some valuable information. Thank you once again. Thank you.
Thank you.
So we hope to see Dr. Kanwar soon on the show, and thank you all for joining us. Here are some coupons that you can use on Apollo 24/7 app. Download the app and get the benefits. Here's the first coupon that we are giving away, the first we see. Type code first we see, and you get 150 rupees off from on consultation, doctor consultations direct from Apollo. This is valid on the first online doctor consultation. And the next coupon that we're giving away is code first 3. Use this code on Apollo 24/7 to order medicines direct from Apollo and get flat 25% off on the first 3 online medicine orders on Apollo 24/7. And the coupon for health our viewers, this is specifically designed for health our viewers. Use the code HH247 to get 199 rupees off on online consultation with Apollo doctors and up to 20% off on medicine orders as well. This is in addition to the coupons which we shared earlier. Thank you. And next week, it's an interesting topic. I think most of you would want to know about this. Next week, we are coming up with asthma care in winters. So if you're asthmatic or somebody in your home is asthmatic, please do come and join us to understand what are the do's and don'ts of asthma care in winters. This is on 20th November, 11 a.m. on Apollo 24/7's YouTube channel. So see you next week. Namaskar. Thank you so much for joining us on this Sunday. So next week, we shall see you with an interesting topic. Thank you so much for joining.